Ever been in a patient room and the doctor starts talking preoperative prophylaxis or NPO status and you nod along, but inside you are thinking, what does really mean? I remember my first time getting a patient ready for surgery. The charge nurse gave me a list of tasks, and half of them were in a language I didn't fully understand it. That moment made me realize terminology isn't just vocabulary. It is the foundation of everything we do. If you are a nurse student, you probably open a Med-Surg chapter, seen a long list of bolded words, and felt overwhelmed before even started. Hi friends, I'm Nurse Mia and welcome back to Get Zen, a RN study group. This is part 1 of the chapter, Key Terms Made It Simple. That's exactly why we started here, because those terms made the rest of the chapter finally make sense. Key terms are just a small part of the work, but they unlock the rest. If you learn them first, the rest becomes easier to absorb. Those words are the foundation. Without them, you will need to read the whole chapter as a guesswork. Most of chapter starts with 10 to 40 terms, and each one connects to at least one clinical pathway, lab, symptoms, or nursing interventions. Those aren't just test words. They show up in NCLEX stems, in nursing reports, and real patient conversations. You will need a language, not just to understand it, but to explain it with confidence. Let's break it down, term by term, cue by cue. Let's get started. Chapter 15, Preoperative Patient Care Keywords. Ablative surgery is the first key term, which means removal of diseased body tissue. Example, organ, tumor, or structure to cure or reduce symptoms. For instance, is removal the gallbladder due to cholecystitis. Advance directive is the legal document stating the patient's wishes regarding healthcare decisions if they become incapacitated. So it's a legal statement of a patient treatment preferences. Includes living wills or durable power of attorney for healthcare. Next is ambulatory outpatient surgery, which is surgical procedure where the patient is discharged on the same day of surgery. So surgery allowing same day discharge. Example, laparoscopic cholecystectomy without overnight stay. Cosmetic surgery is procedure to improve physical appearance without medical necessity. So improve appearance without medical necessity, which is rhinoplasty or facelift. Elective surgery is planned, non-urgent surgery that improves quality of life but is not life-saving. So it's a planned surgery that is not urgent. For instance, knee replacement scheduled weeks in advance. Emergency surgery is an immediate surgery to save life or preserve function. Example, ruptured appendix or trauma. So it's a urgent surgery to save life or function. Example is surgery for ruptured aneurysm or bowel perforation. Exploratory or diagnostic surgery is a surgery performed to determine the cause of symptoms or confirm a diagnosis. So it's a surgery to identify cause of symptoms. Example, laparoscopy for undiagnosed abdominal pain. Informed consent is patient voluntary agreement to undergo a procedure after receiving full disclosure of risk, benefits, and alternatives. So it's a voluntary agreement to treatment after full disclosure. Meaning must include risk, benefits, alternatives, and signed by the patient. Intraoperative is the phase of surgery during which the actual operation is performed. Phase during the surgical procedure begins with entry into OR and ends with transfer to PACU. Last oral intake. The last time the patient ate or drank before surgery, used to prevent aspiration during anesthesia. Time when patient last ate or drank before surgery. For instance, important to prevent aspiration under anesthesia. Minimally invasive surgery. Surgical technique using small incisions and advanced tools to reduce trauma and recovery time. So it's a surgery with small incisions using advanced tools. Example, laparoscopic appendectomy. NPO, nothing by mouth, is medical instruction to withhold food and fluids before surgery to reduce aspiration risk. So it's a preoperative restriction of oral intake, which starts with 6 to 8 hours before surgery to prevent aspiration. Palliative surgery is a surgery to relieve symptoms. Example, pain or obstruction, not to cure the disease. So it's a relieve symptoms but does not cure the disease. Example, a tumor debuckling to reduce pain or pressure. Post-anesthesia care unit, PACU, specialized unit where patients recover immediately after anesthesia and surgery. So it's a recovery area after surgery and anesthesia. Monitors airway, vitals, pain, and surgical site. And also they have 3 phases of this, but this is in the next chapter. Post-operative is the phase following surgery, focusing on monitoring, recovering, and prevention of complication. Period after surgery focused on recovery includes wound care, pain control, and complication monitoring. Preoperative is the phase before surgery that includes assessment, patient education, and preparation, which is this chapter. Period before surgery for preparation. Its preoperative phase includes assessments, teaching, and consent. Preoperative checklist. It's a standardized form that ensure all necessary tasks are completed before surgery, like labs, consent, and PO status. From form verifying readiness for surgery includes lab, consent, MPO status, allergies, and ID band. Reconstructive surgery. A surgery performed to restore function or appearance after injury, illnesses, or previous surgery. So it's a restores appearance or function. For instance, breast reconstruction after mastectomy. Robotic surgery. It's a computer-assisted surgical technique offering enhanced precision via robotic instruments. So it's a surgery performed using robotic instruments. A surgeon controls robotic arms for precision. Telesurgery is a form of robotic surgery performed remotely using telecommunication and robotic systems. So it's a robotic surgery done remotely. A surgeon operates via computer and another location from another location. So that was a telesurgery. Timeout. A final safety check performed immediately before surgery to verify patient identity, procedure, and site. Final verification before surgery begins. Confirms patient, procedure, and site with entire team. Urgent surgery. It's a surgery that should be performed soon to avoid complications but not immediately life-threatening. For instance, fracture repair. Surgery is needed soon but not immediately life-saving. For instance, it's an open fracture requiring repair within 24 hours. And this is the last keyword of this chapter. Thank you so much for being here with me today. I hope this video helped make things feel a little bit clearer and a little bit less overwhelming. If it supported your learning, please give it a like or share it with a fellow student who might need this too. Everything we cover connects back to real nursing, whatever it's recognizing a critical lab, planning safe care, or knowing what to teach a patient. Let me know down in the comments below. What was the most helpful thing you learned today? What still feels unclear or confusing? If this was what you hoped and made it easy for you. You can also let me know if you like the notes for this chapter. Check the description. I usually add some few free resources there just for you. Thank you again for your time and your trust. I'm Nurse Mia, and from my heart to yours, until next time, stay zen, stay grounded. Namaste. Bye from now.